Okay, so we are starting physiology with a very common topic, acid-base balance, injury case scale. Very good. Okay, acid-base picture. Unfortunately, I got a patient, so I need to go. But you can just go through the question. Okay, when we interpret any acid-base imbalance, we basically go through these questions. First question: how is the patient? And is the patient asthmatic? Is the patient COPD? Is the patient peritonic? Is the patient is in septic condition? Or is the patient is in pain after any postoperative leakage or patient is in pulmonary embolism? So first, first view of any patient, suppose any patient coming from emergency, and when we see any patient, first we need to have a basic idea. How is the patient? Patient is young, old, child, adult, and patient is in which state. I mean, patient is able to breathe normally, or patient having any breathing difficulty, patient is having any active bleeding ongoing. Okay, or patient is in severe stress. So this is the first state. In the question they will give a scenario: a post-traumatic patient, or a post-operative patient, or a asthmatic patient, a COPD patient, or a old patient, like this. So the first question: how is the patient? Second is the patient hypoxemic? Means patient partial pressure of oxygen, is it within the normal limit or it is less? Okay, this is the second question. I mean, when we think about any patient, suppose a patient came with COPD, simply in our everyday practice, if any patient comes with any breathing difficulty, first option we see the patient, then we check with pulse oximeter how is the saturation. So, if the patient is hypoxemic, means patient partial pressure of oxygen on the room air, it should be normally it should be 10 to 14 kilopascal. But if patient partial pressure of oxygen is less than 8, then it is respiratory failure. If partial pressure of oxygen less than 8 kilopascal, we take saturation on the percentage like 98%, 100% like that. But in kilopascal, if it is less than 8 kilopascal, this is respiratory failure. So third question: is the patient acidemic? Means patient pH. pH normally it is 7.35 to 7.45. If it is less than 7.35, patient is in acidosis, and if it is more than 4.75, it is alkalosis. Simple. Then, what has happened to patient carbon dioxide level? Normal carbon dioxide level, partial pressure of carbon dioxide is 35 to 45. Okay, and in kilopascal, it is 24.5 to 4.5 to 6 kilopascal. 4.5 to 6 kilopascal. Then, what is the bicarbonate level or the base excess? I have to go. Just you can have a look of this page. Okay. Once again, I will come back and then we'll continue. Yes, brother. What happened? What happened to you? Oh, you fell down? Oh, any accident or any fighting? Fighting? Look, keep your eye closed. Okay. We are going to put some numbing agent, local anesthesia. It will make you pain free. Finish. Finish. Especially in this area, we try to give the minimum amount of numbing agent. Okay. How it happened, brother? Hmm? How it happened? Hmm? Arabic? Okay, now we are going to stitch. Okay, start. Hmm? You're from which country? Ethiopia? You miss Ethiopian food here? Hmm? Do you miss Ethiopian food? Ethiopian food. If you had the option, which Ethiopian food you would like to take now? Khalas pata? What is that? Last one. Huh? Last one. Khalas. In Maldives they say nimoni. Nimoni. Your name? Nuruddin? Nuruddin, I will write some medicine. You come back after 3 days for dressing. Okay? Here's one situation. If, okay, then. Okay, wait. Dressing. Okay, so we will continue. First question: how is the patient? Is the patient? What is the oxygen level? What is pH level? What is partial pressure of carbon dioxide level? These are the very basic, and then bicarbonate excess. Okay, so pH first. This is pH scale, which starts from 7.35. It is up to 7.45. This is the normal pH scale. Okay, if it is less than 7.35, means it is acidic. Acidic. Patient is in acidosis. Now, what is the reason of acidosis? We will see. And if it is more than 7.45, patient is in alkalosis. Okay. Now, carbon dioxide. Partial pressure of carbon dioxide. Carbon dioxide itself is kind of acid. Carbon dioxide is a gas, but when it dissolves with like water or other, it becomes like acid. Okay. So simple, very simple. If partial pressure of carbon dioxide normally it is 4.5 to 6.5. Okay. 4.5 to 6 kilopascal. 4.5 to 6 kilopascal here. Okay. And this one I think millimole. 35, 45. Okay. And bicarbonate level also normal 22 to 28. Yes, Nuruddin. This is your medicine. You can start from the pharmacy, and after 3 days you will come back for the dressing, and after 10 days we will remove the stitch. Okay, don't put any water. Every day you can drink some lemon juice. It will help to heal. Okay. Okay. Lemon juice contain a lot of vitamin C and A. It helps in epithelialization. Arabic. 3 days, come. After 3 days, come. Dressing. Okay. I can speak good Arabic. Okay. What is the bicarbonate level or excess base? Remember. Metabolic acidosis will have a low bicarbonate level. Okay. Bicarbonate level and low base excess. It will be less than -2 because we are talking about acidosis. Acidosis. Bicarbonate. Bicarbonate itself is a alkali. Okay. Alkali. So if okay, and metabolic alkalosis. In alkalosis, base excess will be more than +2 millimole. These are very basic. Now we can go little more. Now arterial blood gas. Normally, Average, we take it as like 7.4. Okay. If it is, see, range is 7.35 to 7.45 normally. Okay. If it is less than 7.4, it is acidosis. If it is more than 7.4, it is alkalosis. Partial pressure of carbon dioxide normal 35 to 45, and partial pressure of bicarbonate. Bicarbonate level is 22 to 28. Okay. Now, every either acidosis or alkalosis, they have both from metabolic or from respiratory or from metabolic. First, we will focus on any one, then other one will be the opposite. Okay. Some people remember it like ROME. So you think about respiratory. Now we will talk about respiratory acidosis, and I will take it from because it is very far. Hmm. Okay. So respiratory also has alkalosis and acidosis. Now you think about respiratory component and metabolic component. Okay. Uh, Component means main element. Respiratory main element will be the gas because through respiration we take the gas. We take oxygen and we exhale carbon dioxide. So mainly it is gas. But in this acidosis or alkalosis, oxygen we take patient oxygen condition. But when we calculate, then mainly carbon dioxide level will vary. I mean, it will take the priority. Okay. So respiratory component you should consider carbon dioxide. Okay. Carbon dioxide itself is a gas and it is acidic. Very good. So if it is respiratory acidosis, if it is respiratory acidosis, partial pressure of carbon dioxide will be high, and if it is respiratory alkalosis, partial pressure of carbon dioxide will be low, and pH will be the opposite. Yes, pH will be the opposite because acidosis means pH is less than 7.4. So if it is any acidosis, when acidosis, then pH will be low. Any acidosis, pH will be low. Any alkalosis, pH will be high. pH will be high. But respiratory component is partial pressure of carbon dioxide. Okay. Now come metabolic. Metabolic component means whatever we eat. Like some people can make rice and other things very quickly and they can eat. So that component will go inside and then they will produce some alkali and some acid also. So consider and they will be excreted through the renal system or the kidney. Okay. So in metabolic, our renal system mainly involved. Remember this one. In respiratory, our lungs mainly involved, and in metabolic, mainly our renal system involved. Okay. Actually, I'm going through these topics after a long day. That's why it is becoming little, but it's okay. As much I remember, I will try. Okay. Metabolic, mainly remember renal system, and here component will be the bicarbonate. Bicarbonate, it's CO3. Bicarbonate itself is a alkali. Alkali means if you put bicarbonate in any solution, like in water. If you put bicarbonate in water, that water will be alkalic. But suppose there is again water and you are putting carbon dioxide, then it will be acidic. Same like this concept. So when it is acidosis and bicarbonate itself is a alkali. So in acidosis, alkali will be less. Almost. Yeah, it's it. You can go through this part again and cover it. It's, hmm? क्या हुआ है कब से तेज बात है मुंह खोले का गला के अंदर इन्फेक्शन हो मोबाइल है आपके साथ आपके साथ है मोबाइल वो यूट्यूब से निकालिए मैं एक वीडियो दिखा देगी सर में दर्द अब ये थोड़ा देखिए आपके गले के अंदर जो इन्फेक्शन हुआ और ये इन्फेक्शन के कारण से भी आपका बुखार हो रहे हैं और शरीर में भी दर्द है मैं एक माउथ वॉश लेकर ये आधा ग्लास नीम गर्म पानी में 4 से 5 ml डालकर गार्गल पानी से ऐसा करके बाहर फेंकना है सुबह 5 मिनट ये पूरा आधा ग्लास गार्गल करके फिनिश करना है सुबह 5 मिनट दोपहर में 5 मिनट और रात 5 मिनट ऐसा करके दिन में कम से कम 3 बार करना है दूसरा गला अच्छी तरह से एक टॉवल या एक मफलर से कवर करके रखें गला ताकि किसी के हवा बाहर से ठंडे हुई हवा गला में ना लग सके दूसरा कोई भी ठंडे खाना पानी ठंडा पानी कोल्ड ड्रिंक्स ये नहीं खाना चाहिए सुलेमानी चाय आप पी सकते हैं और थोड़ा नीम गर्म पानी पीना आपके लिए अच्छा रहेगा और बाकी जो दवाई है ये भी लेना पड़ेगा क्या समझे अपने वीडियो से क्या क्या बोला मेडिसिन के साथ 5 ml मेडिसिन और गर्म पानी में देना है और गरगल करना है कितने बार दिन में कम से कम 3 बार और दूसरा दूसरा है माफलर ऐसा ये गला जब भी आप इसी रूम में बैठेंगे या रात जब सोएंगे इसके बगैर आपका ये ठीक नहीं होगा आप जितना भी मेडिसिन ले लें ये दोनों के बगैर आपका ये ठीक नहीं होगा और अगर आप सिर्फ ये दोनों ही ध्यान से करें आपका ये 2-3 दिन में ठीक हो जाएगा ठीक है नाम क्या है आपका काशिम उमर जी ये दे दीजिए और रिसेप्शन में नहीं नहीं जो जरूरी है वही लेते सर ठीक है आप जाइए उधर रूम में इंजेक्शन स्टार्ट करेंगे ओके सो we have respiratory acidosis respiratory alkalosis we have metabolic acidosis we have metabolic alkalosis in respiratory acidosis what will be the picture just when you see in the exam You need to be, I mean, very, very good in this thing. I'm repeating same thing again and again because if you are confident, some people they feel this part is very difficult. That's why they escape totally from physiology. They escape this topic totally. So 10 marks they are mentally ready that this 10 marks I will not be able to answer. But if you put a little effort, this 10 out of 10 you can answer correctly because this is just like the math. So when you get any question, you need to focus. This is either acidosis or alkalosis. If acidosis, it is respiratory or metabolic. Then if respiratory, you know what is the component. Partial pressure of carbon dioxide is the component. If it is metabolic, then bicarbonate is the component. Then if you know it is acidosis, means acidosis always pH will be low, alkalosis always pH will be high, right? Same. Metabolic acidosis pH will be low, and alkalosis pH will be high. Now, component. If it is metabolic acidosis, bicarbonate will be low, and if it is metabolic alkalosis, bicarbonate will be high because bicarbonate itself is alkali. So more and more alkali will produce alkalosis, right? More alkali will produce alkalosis, and carbon dioxide itself is a gas. So more or acidic carbon dioxide, more carbon dioxide will produce acidosis. This much it is clear. Now, when in our body we have either acidosis or alkalosis, our body has a defense mechanism that body try to compensate or body try to make it again normal, neutral. Okay, that is called compensation. In this compensation, our respiratory system and our renal system both try. Respiratory system mainly take part to compensate respiratory acidosis or alkalosis. Okay, because mainly it is gas. Okay, and if it is metabolic, then our renal system or kidney try to compensate it. How? Now we will see this. How they do this, we will learn it in physiology, other in renal system. But here we are focusing mainly the interpretation. Okay. Now our body has done something. Our body is trying. Normally, our body is always successful to regulate this, and they keep the balance. Like they maintain acidosis and alkalosis. They maintain the pH. But if they fail, or if suppose patient is in COPD patient, or it is a septic patient, or it is a hypovolemic patient, or it is a post-traumatic any who is not normal, then their body cannot produce it, maintain it. Then there will be uncompensation. Okay, how we will know if the pH is normal 7.4? If we see pH is 7.4, it is the baseline or the neutral, means it is compensated. Whatever the situation was in the body, maybe patient was in hypovolemia, and after coming to the hospital, they put a Walaikum Assalam. जी मैं अच्छा हूँ जी आप कोलेस्ट्रॉल की गोली लेते हैं 10 mg की ले रहा हूँ मेरा एक बात आप सुने अगर आप सिर्फ कोलेस्ट्रॉल का चेक करेंगे इसका खर्चा ज़्यादा आएगा और अगर आप फुल बॉडी चेक करेंगे इससे आपका फ़ायदा ज़्यादा इसमें कोलेस्ट्रॉल भी आ जाएगा आपका किडनी लीवर डायबिटीज ब्लड सब कुछ एक साथ आ जाएगा You want to do only cholesterol check? Very good, very good. Okay. आप लोग डिस्काउंट भी नहीं कर रहा ना जी वो लिपिड अजमान में लेते हैं 75 आप मैं जो बोलना था तो मैंने बोला सिर्फ अगर लिपिड करना चाहेंगे आप सिर्फ लिपिड कर सकते हैं इधर मुश्किल नहीं तो उसका कितना चार्ज है वो चार्ज के बारे में काउंटर 100 पे पूछी वो बोले 100 में क्या 100 में 80 पे 75 में बाबा पैसा की बात मेरे साथ नहीं वो काउंटर से बोलेगा Okay, you know what? Sometimes you should not help, you should not give your valuable advice to some nonsense who don't accept or who don't understand. Yeah. Um, I now I regret why I explained to him because here they took a strategy like it is a promotional offer. They are doing full body profile at a lower price, but individually, take- okay, okay, okay. Now, so if pH is 7.4, it means body has compensated, normalized. If nothing is normal, what does that nothing mean? pH, bicarbonate, and partial pressure of carbon dioxide, partial pressure of oxygen, partial pressure of carbon dioxide, and bicarbonate. If nothing is normal, then it is partially compensated. It sounds little odd, but this is the reality. Thank you. If nothing is normal, it is partially compensated. And if carbon dioxide or bicarbonate is normal, but pH is abnormal, pH is still not in the limit, then it is uncompensated. You need to, it is uncompensated. Uncompensated means partial pressure of carbon dioxide and partial pressure of and bicarbonate level. Partial pressure of carbon dioxide and bicarbonate level are normal. But pH is not normal. Then it is uncompensated. Okay, okay. So respiratory compensation and renal compensation. Respiratory compensation means low partial pressure of carbon dioxide because when a respiratory system, suppose there was in the body there was imbalance, acid base imbalance was there. Now our either respiratory system or renal system is trying to make them normal. How you will know which system worked behind this? I mean, by only observing the report. Again, I'm saying you had two report. Day one, there was imbalance. Day two, there is balance. Now, how you can say which system of the patient's body worked to make it normal? By, mm, suppose you have you have no other previous history, nothing. Just you go to ABG report, arterial blood gas analysis. One is showing patient has severe imbalance, and another one showing pH came to normal. Okay, pH came to normal, but others is still some imbalance. But pH is normal. pH is in normal range means it is compensated. Now, which system took upper hand to compensate, either renal system or respiratory system? How you will know? If you see, partial pressure of carbon dioxide is low, then you are sure that it was done by respiratory system, because carbon dioxide will not go through the urine. Makes sense, right? Carbon dioxide will go through the respiration. So respiratory system took part. And how they did it? By hyperventilation. Like hyperventilation. When there is more carbon dioxide inside the body, okay, means there is more acid in the body. So how body try to compensate it? Body try to exhale more and more carbon dioxide. Okay. So it is by hyperventilation. So respiratory compensation means there will be low partial of carbon dioxide by hyperventilation. Now come if you see low partial pressure of carbon dioxide, I understood your point and I will explain that one. But mainly, I'm saying which system to compensate. Actually, these are not the directly the question. But if you understand this theory, it will be easy for you to.
Maybe it's
No, no,
acidosis.
no. I'm saying if there is, yes, if there is acidosis, respiratory acidosis, then renal system compensate it by hyperventilation. Now you understood. If patient has respiratory acidosis and then patient came to the normal, how they came to normal? By doing hyperventilation. Whatever the acid was in his blood, he tried to exhale more acid through the blood in the form of carbon dioxide. Alkalosis will be compensated by other system, by hyperventilation or by renal, by metabolism. That will be mixed. Okay. Now renal compensation means high bicarbonate level by aldosterone system by increasing absorption in renin angiotensin aldosterone mechanism. We will read this thing. Okay. Again, the same question. How is the patient oxygen level means partial pressure of oxygen on the room air? It should be 10 to 14 kilopascal. If it is less than 10 kilopascal means patient is in renal failure, so respiratory failure. And then pH level, either it is acidic or alkalic, then carbon dioxide level, bicarbonate level, color. Now we are moving to the question. Scenario 1. Okay. You are asked to review a 63-year-old female. So how is the patient? 63-year-old. Okay. Admitted with shortness of breath. So you can understand through which direction it is going. Shortness of breath. So it is respiratory something. On arrival, the patient appears drowsy and is on 10-liter oxygen via the mask. So patient was brought with the ambulance and they are keeping oxygen. You perform an ABG which levels of the following, which reveals the following result. Okay. Now look one by one and then need to comment. Partial pressure of Oxygen 7 kilopascal. So normally it is no, unfortunately. Yeah. There will be here. Hey, here 10 to 14. Sometimes you can see 11, sometimes you can see 13. There will be a little variation, but it's okay. And we learned one message that if it is less than 8, then it is what? If it is less than 8, it is respiratory failure. So from the beginning, just by seeing the 7 kilopascal, you can say directly this is a respiratory failure patient. Okay, okay. And pH is 7.2, so this is also less. So patient is in acidosis. Acidosis. Now this acidosis is coming from which system? Wait. Partial pressure of carbon dioxide. Okay, partial pressure of carbon dioxide is 9.1. Normally it is 4.2 or 4.5 to 6, and it is 9 means it is less or high. It is high. So carbon dioxide CO2 is high means it is acidosis. Also pH is less than pH. Ah no, pH is 7. It is less. So this is also acidosis. From the pH we can say pH normal 7.35 to 7.45. Here pH is 7.2. 7.2. So this is also acidosis. And carbon dioxide also high. Very good. Very good. And bicarbonate level 26. So this is within normal level. Now, now,
Also, it's not important.
now, yeah, it is important. Important. See, yeah, partial pressure of oxygen is low. So we know the patient is in respiratory failure. And we don't know yet what type. Because respiratory failure, it can be type 1 or it can be type 2. Okay, we will discuss. Now pH. You should note the level of the pH. Okay, so here pH was 7.2. So it is low means it is acidosis. So bicarbonate is normal. So the metabolic system is not contributing because bicarbonate is directly which system? Metabolic system. So here metabolic system is not doing anything to acidosis, and it's not compensating respiratory acidosis, suggesting that it is an acute dearrangement. So what is the diagnosis here? I mean, this is what will be the diagnosis? Yeah, tell me the diagnosis. This is yeah. Respiratory acidosis. Scenario two. You read this one.
I don't.
From beginning. 17-year-old patient presented to accident and emergency complaining of tight feeling in her chest. Okay, 17-year-old patient, chest tightness, shortness of breath, as well as some tingling in her finger. Okay, this is typical patient. I used to get this type of patient. Then they're in anxiety mainly. 14. Mm-hmm. So you read the explanation next.
To figure out whether there is
O2 was 14. This is normal. Almost like normal.
I suspect that
Okay. Yeah, yeah. Especially, it is no, no, not up. Down, down. It is mainly down, down. Yeah. Carbon dioxide, oxygen level, maximum level is 100%. So it will not go more. It can come down only. Okay, okay. So here see brain and beauty. Okay. Interpretation metabolic alkalosis. Mm. This is metabolic alkalosis.
suspicion.
Yeah, same one. You read this part, respiratory alkalosis. You read this part. That is respiratory alkalosis. Yeah, respiratory alkalosis. Because here first pH is 7.4, so it is alkalosis. Now which system, respiratory or metabolic? Now here carbon dioxide is 3.2, so it is low. So mainly it is respiratory alkalosis. Because bicarb is normal, so metabolic system is not taking any part. So mainly from many direction we can go to the diagnosis. From carbon dioxide level, from bicarbonate level, anything. But mainly we need to go to the diagnosis. See here, this is respiratory alkalosis because pH was low, sorry, pH was high, pH was high, and
And PCO2 was
PCO was low, and bicarb was normal. This is respiratory alkalosis occurs as a result of increased ventilation, which can be caused by anxiety, panic attack, which this 17-year-old patient was there, and the panic causing increased respiratory rate in panic situation usually takes hyperventilation and hypoxia, especially in high altitude in the mountain or in this thing, or pulmonary embolism, or pneumothorax, or iatrogenic. Okay, it happens due to ventilation. The history of a healthy young person hyperventilation with peripheral and perioral tingling would be fairly typical of a panic attack or anxiety. Yes. A blood sample becomes more alkalic and hypocalcemia. Okay, okay. This hypocalcemia is rare. Okay, this is that. Now scenario three.
you took his blood count.
Normal. Okay. Then pH, alkalosis, bicarb, carbon dioxide, normal, bicarb. Okay. So what will be the diagnosis?